We know that receiving a report of a positive COVID-19 case in the workplace can be stressful. Don't worry, you've got this. There are easy steps you can take on your own to keep your facility safe. The information in this video is focused on non-healthcare and non-congregate settings. Documents that are referenced in this video can be found in the video description as well as online at www.snohd.org/COVID-business under the Employers button. Now let's walk through the steps employers should take when notified of a positive case in the workplace. The first step is to determine when it is safe for the COVID-positive employee to return to work. When someone becomes sick with COVID, we consider them contagious for 2 days prior to when their symptoms start, and for 10 days after. If someone tested positive for COVID but they never had any symptoms, we consider them to be contagious for the 2 days prior to the date of their test, and for 10 days after. For this reason, the safest practice is for the employee to isolate at home through these 10 days. If they cannot isolate this long, they should isolate at home for at least 5 days, and until they have been fever-free for at least 24 hours, with other symptoms improving. For cases that leave isolation after 5 days, it is very important that the employee mask diligently with a well-fitting mask at all times for an additional 5 days whenever they are around others. If they cannot wear a well-fitted mask at all times, they should isolate for the full 10 days. To provide more information to an employee who is tested positive, we suggest you send them a link or provide a printed copy of the Washington State Department of Health's What to Do If You Test Positive for COVID-19 document. Step 2 is to determine if the case could have exposed other people at the workplace. Potential exposure did happen if the case was at the workplace during the 2 days prior or up to the 5 days after their symptom onset, or, for those who do not have symptoms, their test date. This is regardless of masking. Exposure also may have happened if the case returned to work after 5 days, but had not been fever-free for at least 24 hours, or if other symptoms had not improved, or if they did not diligently mask at all times when around others for at least the following 5 days. If you have determined, based on the return to work timelines previously mentioned, that exposure may have occurred in the workplace, the third step is to provide written notice of potential COVID-19 exposure within 1 business day to all workers who were at the same work site during the contagious period of the person who tested positive. We recommend sending the potentially exposed employees a link to or a copy of Washington State Department of Health's What to Do If You Were Potentially Exposed to Someone with COVID-19. The information in this document will help the employee determine next steps, including whether they need to quarantine and for how long. When you notify employees of the potential exposure, it is important to protect the medical privacy of the COVID-positive employee. Do not disclose details that could identify the case. To share this information would be a violation of health privacy laws. The fourth step is to notify the Snohomish Health District. Please complete this spreadsheet, which is available at www.snohd.org/COVID-business under Employers. You can fax the spreadsheet to 425-339-8706, or you can contact covidemployment@snohd.org to request a secure email. If you request a secure email, our team will respond in 24 to 48 hours with an email that you can attach the spreadsheet to and send securely to the Health District. You can also call the Health District's COVID-19 call center during business hours on weekdays at 425-339-5278 to provide information about the case. Thank you for your partnership and for everything you do to keep Snohomish County workers safe and healthy.